Good day, I am Virginia Marie P. Bautista from BSN 2B Group 1, and today I'm going to perform heat application therapy using moist and warm compress. So for the assessment, I'm going to assess the wound for size, color, drainage, tenderness, and odor, and also the mobility of the patient, the level of comfort, the vital signs, especially the blood pressure and the pulse, and also the patient's and family understanding about the application and related safety factors. So for the planning, I've already prepared the materials that I'm going to use. So these are the um, pitcher of water, hot water bag, 2 gauze, the container, my clean gloves and alcohol for infection control procedures, then my pillowcase. So before performing the procedure, I'm going to check and verify the order for the application. And then I'm going to I'm going to introduce myself and identify the patient according to the agency protocol. So, good morning po. Ako po si Nurse Virginia. Ano pong pangalan nila?
Ako po si Gabriela Sir Bautista.
Pwede ko pong tingnan yung adjune sa kamay. Okay po. Then, nag-order po yung doctor po nyo na i-warm and moist compress ko po kayo. Yun po yung tawag sa procedure na gagawin ko. So, lalapatan po natin, bubuksan po natin yung sugat nyo at lalapatan po natin siya ng gasa na inilublob or binasa po gamit po yung mainit-init na tubig. So, yung procedure po na to ay makakatulong po para po mapabilis yung paggaling po ng sugat nyo. And since naman po, nakalipas naman na po yung 48 hours or 2 hours, pwede na po natin gawin tong procedure ito, kaya po in-order po ni Doc. So, the patient have a laceration 2 days ago, so therefore I can perform the procedure. So, first I'm going to provide privacy for the client. So, I've already provided privacy for the client. Now, I'm going to perform hand hygiene and other infection control procedures. Then now, I'm going to expose the wound. So, ma'am, i-expose ko na po yung wound niya. So, I'm going to inspect it. So, as I observe, the wound is already healed. So, I can put on moist compress directly. Then, I'm going to put on the waterproof pad to prevent leakage. Then I'm going to pour warm water to my container. Then soak my gauze without touching it. Then apply it above the wound. So make sure that I'm going to make sure that I cover all the wound area. Then after that, I'm going to place another gauze. And tape it. Then after that, I'm going to prepare the hot water bag. So I'm going to check it, or I'm going to tilt it to check for leakage. Then I'm going to pour the appropriate amount of warm water. Then I'm going to squeeze it to release air. So the air is for the evaporation of the water. Then I'm going to cover it using pillowcase. Then place it above the moist compress. So the doctor's order is apply it for 5 to 10 minutes, or pwede naman po na tatanungin ko po yung patient na every time na mawawala po yung heat, papalitan ko po siya. So next is for the evaluation. I'm going to reassess the wound and reassess the patient's comfortability. So comfortable po ba kayo ngayon, ma'am? Okay po. So nakita niyo po ba yung procedure na ginawa ko? Okay po. Naiintindihan niyo po ba yung procedure? Nakita niyo po? Okay po. So, yung ganong procedure po, pwede niyo po siyang ulitin kapag po umuwi kayo sa bahay. Kasi po, ito po kung gagawin niyo po siya ng paulit-ulit, pero may time naman po, or every 5 to 10 minutes po, or every time po na mawawala yung init, makakatulong po kasi yung ganitong procedure po para po mapabilis po yung paggaling ng sugat niyo. So, makakabili po kayo ng warm hot water bag po, pwede po dyan sa pharmacy, and pwede rin naman po kayong gumawa po ng sarili nyo. Lalagay nyo po yung mainit-init na tubig po sa plastic, tapos yun po yung itatapal nyo sa sugat nyo. Pag naman po masyadong mainit yung tubig, pwede nyo pong ibalat yung plastic sa tela para po hindi masyadong mainit yung pagdampi. So, naintindihan niyo po ba? Opo. Okay po. So, then after that, I'm going to remove my gloves. Then dispose. So, I'm going to record and report all the information on the client's record. And I'm going to report any significant informations to the primary care provider. So, that should be all.